We are Ann Arbor's talk station, 1290 WLBY, the Lucy Ann Land Show. Our Milan Area Chamber of Commerce report today featuring IHA and a new urgent care location in Milan. Joining us today, Medical Director of Urgent Care, After Hours, Radiology, and Occupational Medicine. We welcome in Dr. Matthew Ajluni. Great to have you here.
Great to be here.
So this is a new location, and it's down in Milan. It's the Carpenter Road exit. So this is going to be a big addition to the community there.
Yes, we're very excited about it. We've been listening to our patients and our doctors that they want an urgent care in that area because there's just not enough options for them. And we hope that this will serve a big need in the community and the surrounding communities as well.
So this makes how many then urgent cares under the domain of IHA?
So we'll have four. This will be our fourth urgent care location, and we also have an after-hours location, which is only open on nights and weekends. And so it'll be 5 in our urgent care program.
The after hours, is that a new type of idea or?
Not necessarily a new type of idea. It's just that it serves primarily a need in the evenings and weekends for those patients that need us at those hours.
But that's a separate location then?
Separate location in Brighton, Michigan.
Oh, okay.
So we have a location in Hamburg, urgent care in Hamburg, West Arbor, Domino Farms in Ann Arbor.
Oh, that's right.
And now the Milan location.
All right. I think people often grapple with which place do I go to? Should I go right to the emergency room? Can I do urgent care?
Sure.
There are a lot of options out there today. So give us an idea of what kinds of things you do at an urgent care versus maybe an ER.
Sure. I think from the outset, it's not always an easy decision for patients to determine where to go. And I would recommend that they use, if they have a primary care physician, calling them to help them make that decision. We have a campaign at IHA called Call Us First, where we help patients make those sometimes very difficult decisions. If you have a wheezing kid at home or ankle sprain that you don't know what level of care you need. So it oftentimes is not easy. But and let me also say that emergency rooms are fantastic. We're so lucky to have 2 great emergency rooms in the Ann Arbor area. And I don't want to say anything disparaging about our ER colleagues because we're very lucky to have them. But oftentimes many things that go to the emergency room could be seen in a lower care setting, such as the urgent care.
And a quicker setting.
And there's a lot of benefits.
Yeah,
so
right.
Oftentimes it's much more convenient. The wait times can be less. It's easier to access in many cases. And you were previously talking about cost, but cost is a big issue for the healthcare community and for patients for their pocketbooks.
Right.
And so the emergency room sometimes can cost 2, 3, 4, 5 times more than an urgent care for the same types of complaints.
Really?
And so I think it makes a lot of sense for patients to come to the urgent care when it's an appropriate reason. And what are those reasons? So we see patients for sore throats, colds, sinus infections, ear infections, injuries, broken bones, abdominal pain, back pain. We see patients for sports physicals during that season. So we do a lot of stuff. We also have X-ray and ultrasound at a couple of our sites, which is also a great addition and can serve a lot of that need to keep patients out of the emergency room as well.
Besides X-rays and ultrasounds, what else are you equipped to do? And one thing that comes to mind, we're in the midst of flu season. If someone goes to urgent care for flu-related things, often they get dehydrated. They need to have that aspect to it. So are you able to do all of that too? Or?
Sure. We see lots of patients during flu season, and we have rapid point-of-care flu testing to help us decide if this patient actually has flu or not. We can, of course, prescribe the medicines that are necessary to treat flu if needed. We also offer IV fluids if patients require that who are dehydrated. X-ray I mentioned, but sometimes that's required to rule out pneumonia or things like that. So definitely flu is in our wheelhouse and things that we see all the time.
You're equipped for everything, it sounds like.
Well, I don't want to say everything. We do laceration repair. You said what sort of procedures we do lacerations.
Wow.
INDs for abscesses. We can do minor fracture care and dislocations and things of that nature. But the emergency room, of course, we're happy they're there when we have real sick patients, heart attacks and strokes and things like that. So.
Are there any characteristics that differentiate your urgent care services through IHA versus other ones in the area?
Well, I'd like to say we're the best quality one around, but we do put a strong emphasis on quality medicine, evidence-based medicine, and compassionate care for our patients, treating our patients like our family. But beyond that, we also have a program called Save My Spot. So patients can go on our website and save their spot in line prior to showing up.
Oh, I love that.
Which allows you to wait wherever you want to wait, and then you can get a text message 15 to 30 minutes before to let you know that your spot is coming up. So that's a huge patient pleaser and time saver for many people.
Who's eligible to go to IHA, especially insurance-wise? Is there any restriction there?
No real restrictions. We accept the full range of insurances. We have patients that see IHA primary care physicians, which is a large number of our patients, but we see people that have primary care physicians from the university and from many of the other community physicians.
Explain to people what IHA actually is.
So IHA is a multi-specialty group. So we are primary care physicians, we're specialists, we're hospital-based medicine as well, and we are 600 plus physicians and advanced practice professionals, and we're based in Ann Arbor, but we have sites as far north as Howell and south down to Clinton and Milan, like we're talking about today, and we go west to Chelsea, Michigan, and on the east side to Canton and Plymouth. And we're routinely, not to pat our own backs, but we're routinely rated highest quality providers in southeast Michigan against some strong competition like the university and Beaumont and other big health systems.
Dr. Ajluni, are most doctors organized that way where they'd be in a group like IHA?
I think increasingly there's a lot of doctors that are moving into larger groups like that. So the solo practitioners of old are slowly kind of all getting into bigger groups.
And why is that, or what are the benefits of that?
I think from IHA's perspective, when it was founded 20 plus years ago, the physicians came together thinking that together we can be stronger, we can focus on quality, and we can learn from each other and leverage each other's knowledge base and become really a high efficiency, well-oiled machine. So, and especially in the world of healthcare, where we're moving towards value-based care and trying to really incentivize high-quality care, it's becoming more and more challenging for the solo practitioner to do many of the things that insurance companies want to see, quality reports and things of that nature. And so, there's definitely a migration towards being in larger groups.
That's a huge issue, obviously, for physicians, anyone in healthcare, and all of us, too, who use it, insurance, because it's evolving yet.
Sure.
And I don't know how one continues to operate in that world when you don't really know tomorrow what it's going to be.
It's extremely challenging. And when we hear our executives at, so IHA is part of Trinity Health, and when you hear them talk, or even the Blue Cross executives, and we hear it on the news, they all say that it's a challenging time because there's a lot of uncertainty for even them. And so we'll all continue to watch as things evolve, and hopefully more patients can get insured. And,
right.
And as you talked in your prior segment, insurance is a huge thing for.
How do you think that should evolve? How do you think that what would be the best solution down the road for these kinds of things?
For
insurance.
Well, I think the more people insured, the better. And so when we have patients that come in that need our help, and we want to help everybody that comes to our door, and we don't turn anybody away, but it's challenging for them when they get large bills, whether it's from the emergency room or the hospital or the urgent care in some instances. So the more people on the insurance rolls, the better. How that gets figured out, I don't have an answer today, but I think there are logical, reasonable answers that hopefully if we can all get on the same page and work together, we can find solutions. But,
I just know when I get those bills, I just remember how great I felt after they fixed me.
Yeah, aren't you? We're so lucky to have such great health care in this country, and you really feel it when you need it.
Right.
And you get better. And
never been more miserable than when I got the flu last year.
It is not fun, the flu.
Not at all.
You can spot them from a mile away, the flu patients, because they just come in.
Right.
Say, that person definitely has the flu.
How has the season been this year so far?
We haven't seen a huge uptick as of yet. I think it's still coming, but we're seeing a few trickle of patients with flu. I would definitely encourage people to get your flu shots because it's not too late. Now is the right time to go to wherever you can get it. We offer it at the urgent care. We'll have it at the new Milan location.
Can you just walk in, obviously, to the urgent care and get that flu shot then?
You can walk right in.
Okay.
Yeah. And if you want to try to go on our website, IHAcares.com, you can click right on Save My Spot, and you'll be able to get your place in line so you don't have to wait.
I love that aspect. IHAcares.com.
Correct.
That's the website, IHAcares.com. We're talking with Dr. Matthew Ajluni. He's Medical Director of Urgent Care for IHA, after hours as well, radiology and occupational medicine. How long have you been with IHA now?
So in January, it'll be 5 years.
Congratulations.
Thank you very much.
And you come here from Chicago. Tell me a little bit about your career.
Sure. I'm originally from the Detroit area, the suburbs of Detroit, but I went to Chicago to do my residency there, and then I got my first jobs out of residency in Chicago, working in a community emergency room in the north side of Chicago. I worked in some urgent cares. I did some hospital medicine, some outpatient family practice, so I did a number of things in the 10 years that I was in Chicago. And then when we had a little baby, we started saying, maybe we're going to lean back towards Michigan.
They always come home. This is the theme on our show. Every time we talk with someone who's been elsewhere and they come back, and it usually is for family reasons like that, which speaks to the quality of our state, I think.
Michigan is great. I was always thinking I'd go back. I love Chicago too, but it's nice to be back home and around family. And I got lucky to land at IHA. It's a fantastic company, progressive, efficient, high quality, dedicated people. It's a very family atmosphere. We all take care of each other and in turn take care of our patients in the community. And I feel lucky to have landed here. And
it's nice to see the growth at IHA with the new openings like in Milan as well.
Yes, there's a lot of growth happening. We have new locations sort of in the works in the next year to 2 years, urgent care and otherwise. And there's a lot of growth in our primary care ranks as well in Howell, Michigan, and Canton and other places. So
great to see, much needed. And certainly it helps take the burden off those emergency rooms, which I think back, I don't know when the whole concept of urgent care started, but those emergency rooms, when there wasn't that it was incredible to see people all lined up in there.
True. And, patients increasingly want access to health care on times when it's convenient for them, nights and weekends, which is when we see our busiest spikes. And primary care physicians aren't always available during those times. And so that's been a huge advantage for patients and for keeping costs down in the whole system. Keep patients out of the air.
Well, IHA opening the new urgent care location in Milan. It's just off the Carpenter Road exit and Arcona Road, just south of Ann Arbor. And great to see that happening. And catching up with Dr. Matthew Ajluni. Thank you so much, Doctor.
Oh, it was my pleasure. Thanks for having me.
Medical Director of Urgent Care for IHA. And the feature on our Milan Area Chamber of Commerce report. You can visit IHAcares.com for more information. Also, check out the Chamber website, and it has all of the members on there as well. And that's milanchamber.org. You're listening to Ann Arbor's Talk Station, 1290 WLBY.